From the Toronto Star, I'm Raju Mudhar, and this matters. We've all heard the message from public health leaders. Stay at home. Stay inside. It may sound like a silly question, but it is a perfect sign of these uncertain times, and is one that many people are asking. Is it okay to go outside for a walk? It's not so simple now, especially with large fines for people not respecting physical distancing in parks.
Any two people who don't live together who fail to keep 2 meters of distance between them in a park or public square will be subject to prosecution and will, upon conviction, be liable for a fine of up to $5,000.
And further measures, like Toronto thinking about closing access to High Park, which always draws huge crowds for the annual cherry blossom blooming. Police reportedly turned 800 cars away from the Scarborough Bluffs this past weekend. Even as it gets harder, just as we are turning to the science to help fight this virus, we are now turning to Kate Allen, the Star's science and technology reporter, and asking her under what circumstances it's safe to go out for a stroll. Kate, thanks so very much for being with us.
Thank you for having me.
Kate, now, you kind of mentioned this in your piece, and it sounds like a silly question, but is it okay to go outside for a walk right now?
Yeah, it's not a stupid question, and I feel bad for our public health leadership because pretty much every day reporters are like, can we go for a walk? Can we go for a walk? Can we go? It's like, Daddy, can I go for a walk? You know, and the answer, I know it's been confusing, is yes. Right now, the answer is yes, you can go for a walk. And in fact, public health, at least in Toronto, wants you to go for a walk because there are negative health consequences to staying inside also. But there are some important caveats there, some important things to know if you do want to go for a walk. Do you want to hear what those are?
Absolutely. Please let us know.
Okay. So first of all, there are people who can't go for a walk. And those are people who obviously, if you've been tested and confirmed to have COVID-19, you not only should not go for a walk, but you now legally cannot go for a walk in the city of Toronto. There are new mandatory orders that require you to stay at home. And likewise, if you are the close contact of somebody who is a confirmed case, you also cannot leave your home. If you just got back from international travel, there's a federal order. You also cannot go for a walk. You cannot go outside. And if you are ill for any reason, you just shouldn't go outside. You know, whether or not it's COVID-19, you don't want to be passing illness on to anybody else because our healthcare system is already going to be overburdened by COVID-19 patients, so you don't want to risk passing any kind of illness onto anyone. So those are the people who cannot go for a walk. And then for the rest of us, if you do go for a walk, the most important thing to remember is that you stay 2 meters apart from everybody at all times. I mean, unless they're in your own household. So that's like a hockey stick length apart. So those are the rules.
I do love that in Canada, the hockey stick apart thing.
I was actually out for a walk earlier today, and I saw the playground, like the sign up at the playground saying you can't play here was like hockey stick length away. It's like the official city messaging. It's like hockey stick length away from everybody at all times. Everybody knows how long that is.
Yeah, as Canadians, it's a universal measurement now. I think the other thing here, the issue here has been one of messaging. Obviously, public health leaders have been saying stay at home. Why do you think the message about walking and going outside has been a little bit muddled?
Yeah, I mean, I sympathize for a couple of reasons. One is that you have the federal public health leaders, you have our provincial public health leaders, and you have our municipal ones here in Toronto, and then in every other region across Ontario. And I would imagine it's very hard to coordinate the response between all of those levels of government at all times. That's why we saw, sort of shutdowns happen at, pretty close to each other, but for a while there was a discrepancy between what Toronto was saying in terms of social distancing and what Canada was saying. So I think that's a factor, but also I think it is a bit of a tricky message to communicate that you should stay at home, pretty much no matter what, unless you need, people understand that food and medicine are essential reasons to leave your house, but I guess it's maybe not quite as obvious that going for a walk is, but, nevertheless, that's the message, go for a walk if you can. There's
a famous scene from Outbreak where Dustin Hoffman goes,
"It's airborne."
We're talking a lot about community transmission, and I think that may be one of the things that's confusing because COVID-19 can be transmitted through the air in sort of very specific circumstances. Can you explain a little bit about that?
Yeah. So I should say also with all of this, the information on the ground is changing so rapidly and the policy is changing rapidly too. So I hope that while we're taping this, they haven't changed the recommendation to no walks. It's happened to me before. That's something I was working on at 10 a.m. was out of date by 2 p.m. And, so likewise, we've only known about this virus's existence for about 90 days, and there's a lot we don't know about it. But the best evidence right now suggests that the main way to acquire an infection is by coming into contact with droplets that are expelled from people's respiratory tracts, whether that's through sneezing or coughing or talking at a close distance with someone who is contagious. And it is not airborne under normal circumstances. The word airborne is kind of confusing. So in a hospital setting, when you intubate a patient, which is an invasive procedure, it can cause really heavy coughing. And under those circumstances, the virus can become what is known as aerosolized, which means it's suspended in the air in droplets and it lingers in the air for longer for that reason. And that's the reason why these specialized masks, N95 masks that you might have heard about, are recommended for those procedures, whereas surgical masks, the sort of like thinner, not as close-fitting masks that are also available in hospitals, are recommended for other healthcare workers. So under normal circumstances, the best available evidence right now suggests that it does not linger in the air for any extended period of time. And so, there have been studies that have shown that under experimental conditions where you use like a device to throw this thing up in the air, it can stay suspended in the air for longer periods of time. But if what we're talking about right now is what do we need to know to live our lives, the chances of you, if you are going outside, which is, by the way, is also there's more air circulation outside. And if you're staying away 2 meters away from other people at all times and you're not touching surfaces, the chances of you picking up the virus while you're out for a walk, if you're following all those rules, is really, really low.
Let's talk about the flip side. The dangers, of not going outside are isolation, which I think we're all feeling, and just a lack of physical activity. What are the experts telling you about that?
Yeah, I think probably most people listening to this don't need an expert to tell them that if they've been following the physical distancing practices that we all should be following in order to save lives, I don't think they need an expert to tell them how hard it is. Experts I talk to are concerned in particular for people who live in unstable households or even violent households, and especially children. It's not hard to envision a scenario where not being able to leave your house at all could really exacerbate a bad situation like that. I have to say, I was trying to find scientific literature on comparable scenarios to what we're all living through. And of course, there isn't any because this is such an unprecedented situation. So there isn't really like a big body of literature on what happens when you tell most of North America to stay inside as much as they can. The sort of comparable scenarios that mental health experts I spoke to were referencing were like solitary confinement in jails. And obviously what we're experiencing is not as bad as that, but it is true that, being cooped up inside with very little social contact and very little just, stimulation of any kind is not good for your mental health.
So, Kate, what about exercise and physical activity right now?
The recommendation is to get some. I spoke to a kinesiology professor who talked about how quickly all these different indicators of physical health degrade with inactivity. So, muscle strength, muscle size, metabolic health, all kinds of things. It doesn't take that long for all of those parts of your body to get worse if you're being inactive. And he was actually saying he's the most concerned for young people who are active a lot in their regular life. I am like a typical 4 to 5 times a week, go to the gym type person. And I am barely going for a run once a week. I'm finding it really hard to get into my schedule, but talking to that physical health expert about what happens to your body after an activity scares the bejesus out of me. So I'm actually going to go for a run right after we hang up on this call. That's
good. That's great. Good to hear. I know you're an avid runner, so I was going to ask you about that later. But there's another tricky question here, and I know this is a tough one, and it's one about privilege. And it's one of these things where it's obviously easier to get outside if you have a big backyard or because you live in the suburbs, as opposed to a tiny apartment or a condo, which I think is another reason that this message of going outside is really, really important, particularly for those people who are living more in, urban centers that don't have that much green space. Would you agree with that?
Yeah, I mean, I do understand why health authorities and the mayor were sort of scolding Torontonians for congregating in, beaches and trails and other things like that last weekend. But I was also kind of annoyed because I was like, well, where are we supposed to go? I'm not saying people shouldn't do that. It's not safe, but it's also hard in a city like Toronto that is very dense to find a place where you're 2 meters away from everybody at all times. And it's even harder if you live in a very densely populated neighborhood. I would imagine if you live in a upscale neighborhood where with big homes and nice leafy open parks, it's easier to find a space where you can walk around and not bump into somebody. We know, for example, that the leafiness of Toronto is strongly correlated with the wealthier neighborhoods. So I sympathize with people who are just trying to find a space that they can go outside. And then, on the flip side, I've heard people complaining that their neighborhood Facebook groups have people who are saying like, well, just stay in your backyard if you need to go outside. But not everybody has a backyard. Lots of Torontonians live in condos. We don't all have personal private green spaces. So that is not something that you can rely on. And I think that's why the advice on daily exercise, going for a walk, has stayed quite general rather than telling people specifics of what they should and shouldn't do, because everybody's personal situation is a little different. But I did sort of want to hear more acknowledgement of that when I asked our Chief Medical Officer of Health about, how to interpret this advice for Torontonians yesterday. And I haven't quite heard that yet. Yeah, I do think there are special challenges to living in densely populated areas. And, I think like everything else in this weird time, just do your best, basically.
It may sound like a little bit of a weird question, but are you familiar with the Japanese concept of forest bathing?
I've heard about it. I don't know that much about it.
It's basically a practice where people go outside and really commune with nature, which I think is a good idea now, while obviously taking care.
The city of Toronto it calculated the ecosystem services that its ravines provide. Okay, maybe this is a little wonky, but basically it's, if you could calculate what our green spaces give to us in a dollar value, this is what it is. And I actually can't remember the exact figure right now, but in mental health benefits alone, the ravines give us a lot of benefits. You can quantify this. And so, yeah, I think to the extent that people can, it is important to connect with green spaces. And, I should say again, the advice on this could change tomorrow. It could change this afternoon. So, yeah, if you're able to go out and go for a walk and connect with nature, by all means, do it. A hockey stick length apart from everybody.
Kate, that's really, really great for us. Is there anything I didn't ask that you think that we should know?
Just be kind to yourself. It's a totally unprecedented time. Nobody has lived through anything like this before. So cut yourself some slack.
Great advice. I really hope you enjoy that run. Kate, thank you so much for being with us.
Thanks for having me.
That was Kate Allen, the Star's science and technology reporter. As she went out for a run after our chat, we'd like to suggest that you try and enjoy the great outdoors while keeping your physical distance from others. It's also always good to take precautions. Recently, Canada's top doctor, Dr. Theresa Tam, revised her advice on using masks, saying this.
The Special Advisory Committee on COVID-19 has come to a consensus that wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you.
She stressed it's not a replacement for physical distancing, so if you are heading out, it's definitely something to keep in mind. Be safe and take care. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Raju Mudhar, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.